Doctors and nurses on the front line are facing their toughest test yet. The nation's hospitals under pressure from the highest level of COVID admissions in 2 years.
We're all working so hard to get through it and to keep people safe.
What we're experiencing now feels like the plan was not that well put together, that we've just sort of let it rip and see what will happen.
It is really hard. I can see it's obvious, the staff are exhausted.
The rapid spread of Omicron has added a new dimension to receiving patients in the emergency department at Melbourne's Alfred Hospital. All are treated as if they have COVID. Dr. Katie WALDMAN is working an extra shift tonight.
It's very busy. About half of all patients in the department are either confirmed COVID positive or are suspected to have COVID-19. I'm the doctor in charge of the trauma area tonight. In about 10 minutes we've got a sick trauma patient coming in via the helicopter.
We've all been running a marathon and the finish line was nearly in sight. And now, with this new wave of COVID, someone has said, great, you're almost finished that marathon, but we're just going to ask you to start another marathon.
There are now more than 4,500 COVID patients in hospitals, the highest number during the whole pandemic. But this time, staff shortages are becoming critical.
That has specifically made this new wave of COVID particularly challenging, unpredictable.
Around the nation, more than 9,000 health workers are currently furloughed, meaning they're at home isolating because they have COVID or have been a close contact.
Just a month ago, we were having, within Alfred Health, we were having about 10 staff members were testing positive per day. Now, this past week, there's been on average about 150 to 160 staff members testing positive per day. Probably about 10 times now I've been on a shift, and one of my junior doctors has said to me, I've just had a text message from my housemate that they've tested positive.
Nurse Antoinette David is glad to be back in action on the general COVID ward after having to isolate for 7 days.
You need to work in a team to look after these patients.
I was furloughed because I came into contact with a family member who had COVID over the Christmas New Year period. And so, yes, this is my second time in furlough. It's really hard this time around because you know that your fellow colleagues and staff that you work with, feeling the pinch at the moment. We're stretched thin to look after, a huge workload of patients that are coming through.
Dr. Katie WALDMAN says patients walking into the emergency department with non-life-threatening symptoms are tying up precious resources.
The patients with the dry cough, the sore throat, the tiredness, they don't need to come to the emergency department. They can monitor their symptoms at home. But a lot of patients that are coming with these mild symptoms of COVID are, 20 to 40 years old. I generally think it is just a fear and a lack of understanding with the community and the public through no fault of their own. These patients are thinking, maybe I'm going to be the next young person that dies.
Earlier this month, New South Wales Health revealed too many people in that state were wrongly calling 000 for general advice.
000 is not for general health advice. So that phenomena is being seen here in New South Wales.
It's alarmed the state ambulance service, which released calls like this one to demonstrate what not to do.
Ambulance emergency.
I've done a COVID test at home last night. It turned out positive. I'm going to get to a COVID testing.
Okay, what's the address of the emergency?
I'm actually driving now. Do you want me to go back home? If that's what I need to do?
2, 1...
On New Year's Day, the New South Wales Ambulance Service faced a record number of 000 calls, 5,120, the highest number in its 126-year history. Queues of ambulances are forming outside major hospitals in Sydney, and 7:30 has been told COVID patients have been left waiting in the back for hours.
you see a lot of ambulances outside and they're not going to jobs. So they're stuck at the hospital with patients waiting to offload and they can't respond.
Paramedic and Health Services Union delegate KIERAN EGAN says some people are calling for an ambulance because they want to get tested for COVID.
It's very frustrating, especially when you are driving lights and sirens and you're expecting to go to someone who is quite sick, and to be called to someone saying that they're difficulty breathing, only to find out that what they wanted was a PCR test and it's at 2 a.m. And that's something that's putting a massive burden on an already overused resource like ambulance.
Ambulance services are under enormous pressure, with the New South Wales and South Australian premiers apologising for lengthy delays in 2 cases involving ill children. In Victoria, the service there declared a code red last week due to extreme delays.
We've got a system under enormous stress and a massive surge in demand. It's really important to point out that 1 in 5 calls to 000 are not emergency calls.
In the ICU at St Vincent's Hospital in Sydney, staff are again stretched. 4 months ago, 7:30 caught up with nurse Jo FENECH during the Delta wave.
We did have a couple of months where we were relatively back to normal. However, unfortunately, with the Omicron strain coming into Sydney, it's unfortunately thrown a massive spanner into the works, and we've been thrust right back into where we were with the Delta strain, unfortunately, where our COVID ICU has surged. I'm just going to give a little cough.
During this wave in New South Wales, a mix of unvaccinated and double vaccinated patients have landed in ICU.
We look at the numbers today, 200 people in ICU. 50% of those people in ICU are unvaccinated. The evidence is clear, and that's why I continue to ask people right across our state, if you haven't received that booster shot, please go out and do it.
One of those patients was 24-year-old James Condilios, a fit and double vaccinated young man who died at St Vincent's this month.
To see those poor patients and their family members and their loved ones have to go through all of that, it's just absolutely heartbreaking, and my deepest sympathy and condolences go out to the family and friends of that particular patient.
It's not over yet for these frontline workers, with thousands more COVID cases predicted by the end of the month.
I've just stepped outside for a break. It's 9 p.m. on Saturday night. I've got 3 hours left of my shift.
I am worried. I already have colleagues, other health services that have been asked to cut short their annual leave to come back to work, and it's not sustainable.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.